Now let's talk about our special populations. So our infants, our children, our geriatrics. So with our infants, that incomplete development of the GI tract in our young infants slows that absorption of oral medication and it delays the elimination. So the same medication may be more potent in an infant than it is in your adult. However, in your children, they can metabolize some medications much more quickly than adults can. So they may require higher doses or more frequent administration of some medications. Also, the products of metabolism in children can vary from those seen in adults, which may sometimes result in unexpected responses. So just watch your kid, listen to them. If they're still hurting, they're still grimacing, that is probably the most underdosed population we have. We're scared to give kids medications. Guys, once you see a kid that's hurting, they've got that femur fracture, tib fibs, ankles, arms, treat them. Do not let them sit there in pain. Yes, well, I can ice it and I can reposition and splint it. They still hurt. They have a bone broke. I don't know about y'all, but give me something. It don't have to be a lot. Half their dose. See how they do with it. Then give them a little bit more. That's fine. Just explain why you're doing it in your documentation. Then my little geriatrics. So my elderly patients, because of their hepatic functions and their GI activities slow, this is going to delay their absorption and their elimination. So in addition, geriatrics are often taking several other medications on top of that. So then I've got the interaction of the polypharmacy. So we have so many medications going on. So these concomitant therapies may interact and modify the effects of each medication. So furthermore, because geriatric patients may take a large number of medications and may have alterations in their normal mental status, geriatric patients may unintentionally overdose on a particular drug or forget to take it. So you get called out and it's like, Meemaw's not acting right. Or they grab the wrong one. They put 2 of the same medication and they double dosed. And now they're having an adverse reaction to it. So for us, making sure that we have our rights, making it's our right patient, our right medication, and double checking with our partner, even if it's an EMT partner. The one that got taken off the truck when I first started was we had epinephrine and we had Lasix. So Lasix helps with blood pressure and fluid overload. So usually it would bring their blood pressure down as well as help them with their congestive heart failure. Problem is you don't want to give that CHF patient a dose of epi because their heart rate's already elevated because they're compensating for the breathing. You grab the wrong vial and now I have just dosed my congestive heart failure patient with epinephrine. And that did happen, and it got taken off the truck. So that is a huge error, and it killed the patient. Our error killed the patient. So make sure it is the right medication, right dose. Take it very seriously. Making sure that I know that this is the right dose, but here, double check me. I want to make sure I'm doing what's right for my patient.